Lots of familiar faces. Welcome in, everybody. Good afternoon. All right. So we're going to go ahead and jump in. Welcome, everybody. I know we're getting towards the end of the year, so appreciate your time connecting with us before the holiday break. I hope all of you get some time to spend with friends and family. Very excited to be presenting alongside Renton School District and City of Renton here today. And we're going to be focusing on really talking about the progress we've made in 2024 and our plan heading into 2025. All right, in terms of agenda, as always, we're going to start with a little bit of grounding. For folks that have already heard this story, it may be a little bit of a repeat, but for new folks, just want to make sure everybody has a shared vision and understanding of where this work is headed, where that North Star is that we're reaching for, and then our strategy and approach. And then we'll pass it over to Davina and Celia to talk about our accomplishments, kind of where we've been over the last several years and in 2024. And then we'll take a look forward in 2025 on where we're headed. And then really excited, sort of at the halfway mark, for us to announce a new funding opportunity for housing and behavioral health organizations that will be available in 2025. This is really an opportunity for us to strengthen and grow the network. So you'll hear more about that from Mary Jane Van Cleve at the City of Renton, and then my colleague Hannah Rapp Brown, who's going to be helping lead that work. And then we'll have time towards the later half of the session to open it up for Q&A. We'd love to hear from you about how the hub is going, what improvements you'd like to see, and where you'd like to expand the work. As always, a quick reminder, this closed captions are available for the session. You just click the CC button to access. You can reach out to Brian in the background. He's a technical support person if you're having any issues there. Everybody will be muted except for the presenters. When we get to the Q&A session, feel free to jump off mute. Celia, my colleague, will be monitoring the chat, so feel free to ask questions or post some comments in there, and we can get those going. And then this event will be recorded and shared with participants after. All right, so now I'm going to pass it over to Vicki, who can help ground us in the work.
Sure, thank you very much. And I just want to say how grateful I am that all of you were able to join us even during a busy holiday season. So thank you for all of your time here. I know you've seen this slide before, but what I want to do is just thank you for being here and to share with you sort of where we're trying to go and how it's emerging and why. Excuse me. So basically, if you think about it this way, when we started with this, it was pre-COVID, and pre-COVID, we were trying to connect students to community-based support, and it was working for the most part, because our school counselors had relationships with you in the city and in the community, and they would know who to call and how to call those people. But with COVID happening and the increase in mental health needs and the sort of crisis that occurred as a result, we were finding that, and the turnover with counselors as well, by the way, we were finding that we wanted there to be sort of a no wrong door, because what was happening was that counselors would just start calling each of our community-based organizations and saying, hey, can you support? Do you have room? Can we put a kid on the wait list? Things like that. And then they would send emails out to each other saying, does anybody know if anybody has any space left? Because the crisis was so much that kids were on long wait lists. We also discovered that we had and still have partners, maybe at some schools that weren't at other schools, so potentially not the most culturally responsive partner for a family who maybe one family goes to a different school that comes from a different language, et cetera, that isn't the predominant language at that school, but is at a different school, and they didn't have access to that help because the partnership was at the other school, et cetera. So you kind of get the problem here. So our dream was to say, how can we make it so that in the city of Renton, there is no wrong door, that if a student needs support and the type of support they need to succeed in school, that they could get that from whichever organization, whichever person in the school district, whichever the person in the community is the right place to get that support. And so we began this community hub project, this learning network, where we started working with all of you to say, what would it look like? What do we need? How are we going to meet the needs for these kids? And as it's growing, it's getting more and more exciting and more real and more accessible to kids, where we can literally say to a student, oh, well, we think we can get you support, and we can go into our hub and try to get them the support that they need as we go along. So our North Star is really, how do we build out this system-wide support for students, where students across our entire city can get the access to the help that they need that's culturally responsive to them, without it depending on who knows who and who can make what call, just because we're all working together in a network. So if there's questions about that afterwards, I'm happy to try to answer those, but that's where this whole project is going. And I feel like we're going there because we as a community have been in these meetings going, what would this look like? How can we get there? And we as a city have been saying, let's do it together. And I am incredibly excited to be a part of the journey.
Thanks, Vicky. Having that North Star and that vision is really the opportunity for us. You know, the question that we've been wrestling with over the last several years is how do we get there? And so you know, it's one thing to sort of, you know, want to have the no wrong door approach available. It's another thing to really, you know, build the infrastructure and the network to support that approach. And that is really hard work, and it takes a lot of collaboration between the school district, the city, and all of the provider partners on this call and elsewhere, to be able to work together to do that. So we're really using this sort of collaborative network approach to help us build the systems and infrastructure. I'd say the good news is, you know, we don't have to start from scratch. There's lots of proven models and technologies that can help us put the puzzle pieces together to build this network and infrastructure. But at the end of the day, it's really up to the partners on working together to implement. And so we're making a lot of progress. I did want to highlight just a couple of the proven models and technologies that we're using for the network, just to make sure everybody's aware. First and foremost, really is the SB Expert model. So for those of you who are unfamiliar, this is a proven model developed by King County and Seattle Children's, called School-Based Screening, Brief Intervention, and Referral to Treatment or Services. And it's really a framework and a model that enables both the school counselors or school social workers or school nurses to work together with community providers to deliver a coordinated set of services. And so, you know, thanks to Delaney and her team at King County, this SB Expert program has been implemented in Renton School District, but also I think 12 other school districts in the county. And so this is really the service model that enabled us to start to put the network together. There's a few other service models and frameworks that I think are worth just letting folks know about. One is the multi-tiered systems of support, which I know has been adopted statewide at OSPI. Really is a framework for us to, you know, figure out how schools and community providers can work together to deliver a tiered set of services. So we're using that framework to implement this hub model, as well as starting to look at the CDC WSCC model, which really stands for whole school, whole community, and child. So this idea of, how do you really build a whole child set of services where you can, do a whole person or a whole child screening, a whole child assessment, develop a care plan, and then work with a team of coordinated providers to deliver services. There's also the work out of the Camden Coalition on the East Coast. They developed a community care hub model that we're using here locally. They've set this up at the regional level. We're not using this at the local level to really drive the services. And then technology wise, right now we're using a application through Microsoft Teams, Microsoft 365, to enable school counselors and community providers to be able to coordinate services on the network. And then you'll hear more about this, but in the coming year, we're looking at how to also implement or use some of the state's health information exchange infrastructure to be able to do things like insurance lookups, and start to put together more of the data and metrics on outcomes and effectiveness of interventions. So lots of puzzle pieces that we can borrow from to help us put this network together. All right, now I'm going to hand it over to Davina, who's just going to give us a quick walkthrough of where we've been to date, and mostly focus on our progress here in 2024 and where we're headed in 25.
Thank you, Adam. Hi, everyone. As Vicky mentioned, right, we've been through this journey, and it all started to try and address our mental health situation here in our community, whether that is mental wellness or trying to figure out how do we address some of the challenges that our community is struggling with. And so, you all have been part of our journey, and we are very fortunate to have that. And this year, we have been able to receive referrals for behavioral health services, and we were able to co-design that last year and pilot that. And so all the work that has come together has been a collective and collaborative work and effort. And so that is definitely something that we truly appreciate. Where we are now, as far as the hub, is really trying to scale it up and then also sustain the work, because all this work that we have all put into, we want to be able to continue to see it going and growing, and people are finding the need that this has been helpful. And so today we're going to talk more about what that has looked like for our accomplishments and where we would like to head in 2025. So as far as social emotional learning, we are fortunate to say that we have all of our schools have access to social emotional learning curricula. In addition to that, we have our partnership with the Sounders FC and Rave Foundation, as well as Providence, to be able to have youth mental health programming in 6 of our schools, 2 of which are our middle schools and 4 high schools. And then we also have our SB Expert program that we have implemented, and we have been able to launch that this school year with 3 schools. This school year, we've had 2 schools in the past that have been doing that for the past couple of years. And so far this year, including last school year, we have screened 421 students. So that is a big number, and I will say it's been a big lift for a lot of our counselors, and we definitely appreciate their work in being able to check in with our students and follow up with them and make those referrals when needed. For the telehealth providers, we are able to have Hazel Health. This has been a great resource as we try as a community to try and be able to serve our kids. Because of COVID and the capacity of local providers, we've been able to have Hazel Health meet with our students, all our students, if they are wanting those services. And since those services have been provided both last school year and this school year, they have served 558 students. That's 63% of the students who have been referred. And if you take a look at the number of sessions that they've had, that includes intake and therapy sessions. That's thousands. It's definitely something that, you know, our community can't do alone. And so being able to work with Hazel Health to provide that telehealth services have been truly amazing. As far as this school year, in referral to community providers through the Student Health Hub, we have been very fortunate to keep adding local providers to the hub. And so most recently, we've been able to add Project Be Free, the YMCA, and You Grow Girl. Being able to have the different options for our families, and also every agency has their expertise or specialization. So it's been great to have those options for our students. And so since then, we have been able to launch this. So last school year, we started with last school year, we had 4 of our schools, our middle schools, accessing the Student Health Hub. And now we have expanded to eight schools. So that includes 2 elementary, 4 middle schools, and then 1 choice high school, which is Tally High. And also Renton Academy. Got to do my math. Total of 8. Since then, since the development of the hub, we've been able to onboard 13 providers, as you can see here, and we're going to have soon, and hopefully soon, we are going to have a separate slide to show everyone's logos, because it's definitely a privilege and honor to be able to work with y'all to serve our kids. 40 students have been referred, and of those students, 19 have been served. And so we're continuing to help our kids get connected to those resources. And so, you know, we're going to continue the work that we're doing and continue to try and work with everyone to be able to do this work and sustain it. And so in 2025, our hope is that, of course, we're going to continue the access to SEL curriculum. And then we are hoping to expand the partnership with Sounders Providence and Rave FC to 2 additional middle schools. And with that work, it's really different programming based on the student needs, and it's really student voice and choice that we're trying to get from what their understanding of what their peers need. And so really listening to what the kids are saying and what the kids want and feel like they need that. So trying to add new programming to those schools. And then we are also looking at having Risden Middle School and Renton Academy screen in 2025. So hopefully in January or February. We are also going to continue to offer Hazel Health services. We are fortunate enough to have them for another school year to be able to provide the telehealth services as we continue to do this work in our community. In addition, as far as the referral hub, the Student Health Hub, we are going to be expanding that to 16 out of our 26 schools. And so I will tell you, there are people we have counselors who are asking for this resource because of the need and because of their capacity and the ability to be able to connect our student with the agency that they need, and having that closed loop communication has been valuable. And so when other counselors are sharing about the hub and they hear about it, they're like, oh my gosh, I want that. And so it's definitely something that's helpful all the way around. I feel like it's a win-win situation. And so we hope to be able to continue this work, and it's really exciting to be able to do that. And I want to also share with you that we are going to be adding more to the hub. And so Celia is going to share more about that.
Thank you, Davina. So really excited to share with everyone about kind of these new areas that we're hoping to launch into. We know that really the hub has been successful in the behavioral health and mental health space, but we know that our students have diverse needs. And so we want to try and meet those needs. And so one of those needs we know is housing. And so we've really embarked on kind of a co-design development process to address the needs of students who are potentially experiencing homelessness or who are housing insecure. And so we had co-design interviews this fall with 6 different housing organizations in the Renton community, to really learn about their challenges and pain points, to learn about what their current referral processes are like, and kind of opportunities that they see for improved coordination and connection to schools and Renton School District. So these organizations include Catholic Community Services, Vision House, Wellsprings Multi-Service Center, Reach, and Mary's Place. And so we're so grateful to those partners for really, giving us their time to learn. And so we're taking these learnings to basically see how we can develop a referral pathway for housing in the hub, so that school counselors, when they identify a student with a housing need, they can potentially send that student to the hub and we can match them to an organization. So we're going to kind of, we've been following the same co-design process that we had for mental and behavioral health, and kind of our partners that we had for partnering in that space, and it turned out really successful. So we're trying to replicate that and ensuring that we're bringing in the voices and perspective of our housing organizations in the community. We're also working on case management services. We know that a lot of our current providers on the system provide case management, and we're looking to delve into that more to really address students who might have complex needs, and who kind of need more case management, because we know that our providers in our community do kind of service that. So we're also looking into adding that pathway for the hub and for school counselors to refer to. I also want to mention kind of the IT area. Adam kind of mentioned it earlier, but we know that student coverage and insurance eligibility is a real challenge for not just school counselors, who usually it's difficult for them to find out what insurance a student has, but insurance is really important for us to be able to make a qualified match to a community provider. So we are looking to add basically an insurance eligibility lookup by partnering with our school districts in one health port, so we can make this process easier for our providers and let them know when we've actually verified student coverage, which should help them be able to kind of accept, hopefully, or potentially decline a student referral. So really hoping to kind of make these improvements for ease, not just of school counselors, but also for our community providers.
Thanks, Celia. Thanks, Davina, for that recap. And now I'll pass it over to Mary Jane Van Cleve to talk about funding.
Good afternoon, everyone. MJ Van Cleve. First, I do want to acknowledge Deputy Chief Chuck DeSmith. He's actually the big connection piece and the glue to why the city has this relationship with Health Commons and the school district right now. So just want to recognize him. The city did get behind this in a very large investment. We saw this as a utility. Developing this tool and framework is no different than us investing in our streets and our water utilities. And so that is to provide equitable access and to be able to scale and prioritize. So we saw this as an invaluable investment. We also saw this as an opportunity to ensure that the organizations that we fund for human services for adults, families, and children were actually being rendered by those families. And so the closing the loop is for us as a city, the accountability piece that we were very much looking for. So we look forward to getting more information. It also allows us to pivot our resources and be adaptive to the outcome and data that's going to be produced from this, so that we're, again, continuing to align and invest alongside the school district, because we want to build a resilient community and we want to create a stronger safety net that really helps parents and families thrive regardless of circumstance or as situations change and influx. We're excited to see Health Commons help us with the subgranting that they're going to be taking part in, and we do find that to be a very exciting opportunity. We have received calls from other cities and other agencies and school districts interested in this model, so I'm excited that Renton is continually at the forefront, and we're working with the school district closely on this. I think that's really it for us. It's really our position is really recognizing that we didn't have all the solutions, and that our approach of funding organizations previously was of value, but it did not provide the connectivity to ensure that it was more prescribed to our city and more prescribed to our school district. So having this framework is really invaluable as we design basically a responsive set of needs unique to our school population and student population.
Thanks, MJ. Hannah, if you jump on and give us a little bit more detail on the funding opportunity that will be coming here in 2025.
Hi, everyone. Good afternoon. I'm Hannah Rapp Brown. I'm the Director of Community Programs at Health Commons Project. Thanks, MJ, for kicking off the announcement. I'm here to talk a little bit about some of the details related to this funding opportunity. So total amount you saw on the last slide is 1.26 million, and these funds will be available from 2025 through 2026. So thinking about some of the details related to that term. Who's eligible? Agencies providing behavioral health and or housing related services to students and families in Renton. So if that sounds like you and your organization, I look forward to working with you to learn more and help you access some funds. Just to dive a little bit deeper into what type of projects will be funded. This sort of grant, right, is really focused on providing funding that helps increase, your provider's capacity, as well as update some of the sort of data infrastructure that you all are using. So you can kind of think about potential projects might include purchasing software or hardware that helps your organization maybe do, both or one of two things, right? Accept referrals from Renton School District via the Student Health Hub that you've heard about today, and or reporting health information about your clients back to King County or Washington State via a health information exchange. So that's one good use case for this funding. The other are those sort of project-related labor costs associated with, again, sort of these one of two things, right? Accepting qualified referrals from Renton School District via the Student Health Hub, or sort of project-related labor costs associated with, developing the infrastructure or working on the initiatives that help your organization report health information about your clients back to King County or Washington State via health information exchange. The funding in this grant is reimbursement based. So on a monthly cadence, your organization would submit an invoice to Health Commons Project, and that would include, spending documentation as well as some light reporting. So today our goal is really just to announce that this is available in the new year. I would imagine that this is prompting many questions for you and your organization, and I really look forward to exploring those more with you in the new year. What I ask of you all today is if you're interested in learning more about this funding opportunity is go ahead and enter your name and email in the chat. I will, of course, send all of our information out to the full attendee list here, but appreciate folks sort of calling themselves as interested right out the gate. So in the new year in January, you'll hear from me about the application process. But if you want to spend some time via email or a quick meeting, I'm happy to connect with you. My contact information is there on this slide. Hannah at Health Commons Project, and I look forward to talking with you more about this opportunity and how it can help your organization and the families that we serve in Renton. Thanks, Adam.
Thanks so much, Hannah, and thanks, MJ. Great to see folks put in their information in the chat for Hannah to follow up with. We will be reaching out with additional details, as Hannah said, in 2025. So more information to come there. Would love to now open it up to the group for questions that you have maybe about the funding opportunity, about some of the programming updates or where we're headed in 2025, or comments, thoughts. This is sort of an open space for the partners to really for Renton School District in the city to hear from you all.
I just have a couple questions. I lived in Renton for years. My husband worked for the city for years. So um, you have a lot of languages that you're serving in your system. So how is your agency able to tap into Amharic, Tagalog? Let's name a few. How is that working?
So as far as the accessing the hub, we do translate our top 5 languages, both for SB Expert when we send the information out, as well as for sharing information about the Student Health Hub. And we also let our school counselors know that if there's another language, then let us know. So I will say, though, that not only did we do the top 5, we've also added, I believe, 3 more languages because of the requests. And so we are very open to adding more upon request when our counselors let us know that it's needed. And that typically is known based on family engagement or parent engagement, when they engage the family as far as letting them know about whatever it is and the concern is, and also the resources that are available, and what if a referral needs to be made.
Okay, great. And then in terms of the telehealth, am I a student using it at school where I have internet access, or am I a student who may or may not have access at home?
Both. So yeah, so caregivers or the student can determine whether that is access at school or whether it's access at home. And we have a space provided for them if it is access at school.
Great, thank you.
We have a question in the chat, Adam, from Chuck. He said, "Hi, Adam, thoughts on how FD Cares can support in 2025?
Thanks, Celia, and thanks, Chief. Great question, and maybe Chief, to start off, I don't know if everybody's familiar with the FD Cares program, so maybe just giving a quick overview of the service, and then we can answer your question.
Sure, just a quick overview. FD Cares, so we have 2 vehicles in the Renton area. They're actually fire department employees, and they're in a non-emergent kind of a referral system where we have an RN and a social worker that work together to follow up with Renton Police and to Renton Fire, all of our calls for low acuity needs. And what they have done, and I believe maybe Vicky or some of you on this call have worked, with some of them to get their assistance. They're a fantastic help with navigation in a vehicle for outside of the school. So FD Cares can actually help support a police officer that's following up with a child from the school at their home. They can help provide services. They're almost that bridge, maybe in between home life and school, and anything we can do to help that bridge and help that navigation so great work can be done at the school. That's where we like to live. And so it's a fantastic resource. We've got wonderful social workers and nurses that are there to help. So I would love to at least understand, Adam, how that fits in and some of the vision in 25, and what can we do to better support you?
Yeah, that's great, Chief. It's the right question. Yeah, I think there's an opportunity for us to think creatively, sort of how I know the FD Cares program doesn't neatly fit into sort of a behavioral health or housing, community provider box. But I think there is some creative ways that we can think about how FD Cares might plug into the network, either to accept referrals or maybe even sending referrals at some point. So maybe I'll set up a time with you after we can do a one-on-one, and maybe bring in Davina as well to think through what a project might look like. How does that sound?
That sounds great. Yeah, and FD Cares is accessed, through a 911 call, but most often the police and fire will do the referral. but also the school district does have access lines to get a hold.
Adam,
Yeah.
can I have a follow-up question to the chief?
Yeah.
Chief, is it fair to say FD Cares is almost like a mobilized case management system? I mean, with the software that you have and just, I think, I know we've looked at FD Cares like that and that's where we struggle sometimes is having the case management capabilities out in the field. We have outreach, but not always case management. Is that fair or is that a stretch?
No, that's fair. And especially if a police officer is following up and meeting with the family for a student at home, police and fire, we have a skill set. And what FD Cares does is I think in a more holistic way can help with that interaction. They can lead, and you have a social worker that understands behavioral health needs. Police may be looking more on the safety side of the student and the school, but the FD Cares can maybe get a little deeper into the behavioral health side and 100% with referrals and getting them into the system where we can follow up and do additional follow-ups. And again, it's providing police and fire and that additional skills that we don't normally have as responders. So it's the good additional tool through 911 that we have, and they can be that mobile navigation. I agree.
And I just said that, Adam, just from the whole health model for the child, other family members, I don't know, kind of that environment sometimes that maybe the school district is not that resource. Maybe that's where FD Cares can be kind of that companion model.
100%, MJ. I think that's such a good point, and really, I think as we start to think about how to move towards this more whole child approach, the one of the key first steps is how do you really do that 360 sort of picture of what's going on in this child's life, what's going on in the family life, that is impacting the student's ability to learn and be successful in school. So if there's a way to sort of extend the reach of the school counselor, having the fire department do some of these more complete interviews, I think that could be very, very helpful. I don't know, Davina, Vicky, what are your thoughts?
Well, while I was in this meeting, I did get a crisis call. So it's kind of one of those situations, right, when students are self-harming and, it would be helpful to have that resource. And then kind of looking at what are the next steps with that, right? How do we continue to work together in communication and service coordination? So as you were talking, Chief, I had my gears turning. And so I'm definitely looking forward to talking more about what that could look like.
It was a little bit too large to put in the chat, but I just emailed it to you, Davina, and Adam and MJ. Just some good contacts that you can share.
Great. Thank you so much.
You bet.
Others, would love to hear from any maybe of the community providers on sort of how it's going with receiving referrals through the hub. If you've received those referrals, if there are ideas you have around system improvements and ways we can improve the communication and coordination between the partners.
I would say that, so I'm Liz from Valley Cities, and the person who actually gets the referrals in Renton, the clinic manager, is not on the call. So I'll just sort of speak generally that I think things have gone really well. And my sort of feedback on the referral system is that I have appreciated how much that folks have heard like our input about what how it worked and have streamlined things. And so from my perspective, I've just appreciated how open everyone has been to make it easier for people to accept the referral. So, and track and stuff like that, streamlining it into one section instead of a couple different sections with different messages going back and forth. So I have definitely appreciated that. And I know that the other manager who is on here has told me that she appreciates it as well. I did have a question about the funding real quick, just to double check. You mentioned 2025, 26, and I do manage some contracts that come from other places that are school-based, and some that are school calendar year, and some that are annual. And so I just want to make sure this is a 1 calendar year during the school year, correct?
No, it's calendar year using your traditional January to December. So
Okay.
January 2025 to December 2026.
Okay, so it's actually 2 years. Okay,
Yes, thank
that's
you.
helpful. Thank you so much.
2 calendar years. Yes.
Yeah, thanks so much, Liz. And really, I think your comment about the software for the referral hub, sort of speaks volumes to the importance of the partnership. We can't build these sort of systems in a silo. So having the engagement from your team and the feedback process, really is what makes or breaks these systems and services. So really appreciate your willingness to lean in on this. It looks like we've got a question here from Dr. Waring. Curious if those of you doing screening referral from schools and those providing treatment after referral are identifying some common additional needs, for example, for more specialized clinical services or additional supports beyond behavioral health. Davina, maybe you can kick us off responding to that one.
Yes, thank you. So I will say, as far as when we screen our kids and a referral is made, one thing about the hub is they're getting more information than they typically did previously, and it's pretty consistent as far as what information they're getting. So based on what is identified, we are able to identify what the reason of referral is. As far as what our providers find out, we don't have that information as far as that data goes, because it depends on a release of information. I will say though, just some examples, because I know some of you have not experienced the hub and may not be a behavioral health provider, but I do want to highlight some cases that where we received a referral. For example, one elementary student, the reason for referral was for emotional abuse, and that student was referred to a kin, and within 2 weeks, an intake was scheduled. With one of our students who is in middle school, that student was having school avoidance and anxiety and history of trauma, and that student had received services for 5 months with Valley Cities. We had another middle school student who was struggling with attention, depression, substance use, academic issues, and an intake was done with Seneca within a couple weeks. And so this information that we get in we know that there's a warm handoff. We know that our caregivers are getting that support and that connection to the resource, and being able to have that closed loop of communication, and just knowing that the referral was received and there was something done. Now, if a student, for whatever reason, the provider is struggling in reaching the family, we have eyes on that as well, right? Because that tells us, oh, let's have a counselor follow up with the caregiver and say, hey, this agency has been calling, you might want to return their call. Are you still interested in services? And so we're really trying to work hard in our conversion rates as far as actually getting them served, right? So I think, just to go back to answering your question, as far as we know on the school end of things, it really depends. We provide them the information. Now, as far as what happens after that, it depends on whether there's a release of information. And I think I'll let a treatment provider be able to say on that what that's like on their end.
Yeah, thanks, Davina. Any community providers want to provide Dr. Waring with some feedback about some of the common needs that you're seeing, and anything related to specialized treatment services?
I'm not a provider, but I'm going to throw out in there one thought that came to my mind this is Vicky, when I was reading the question was, for example, anecdotally from schools, we hear about substance abuse and disorders and things like that, and how we could use more support in managing that type of a situation. So just throwing out there as an example, a specialized need that our schools are all telling us, what can we do and how can we get help with that?
Keith and Family is providing substance use treatments. We've only had a couple, 2-3 referrals from the hub. We've had several from Renton High and Tally outside the hub. So we are following through with the substance use, and I believe we're even doing a little bit of mental health too, if we can fit it in with the scheduling with the student. So I can't think of
Absolutely.
anything else that besides the substance use that we've been working on so far, but we are available, and we do have 2 different counselors that can go out to the schools. We have an arrangement with the Renton School District, so we can be reached out to.
Yeah, with my psychiatrist hat on, not my school board hat. I have to be clear with what I'm doing. So I work for a pretty small agency at Seneca, and I think a lot of the referrals that I've seen from our kids in the district are pretty reasonable sort of psychiatry. They have depression, they have anxiety, they have ADHD, they have maybe aggressive behavior or acting out behavior. I think more specialized things that are difficult are if a kid has actual psychosis. And that's one that I've struggled with, trying to get them what they need. As a psychiatrist, I can do it, but not necessarily a lot of other supports for younger kids. Even though we have New Journeys programs in Washington, it really is not necessarily doing what I expected it to do. So that's one that's really been a struggle for me, is psychosis. I think for eating disorders, because I did that work, I know how to refer. Substance use is always difficult, like Vicky was saying.
I just wanted to comment and maybe offer also. I'm not totally sure who everybody is in the room, so there may be people better positioned to help with this. But so I'm both, I guess I have 2 jobs. One is as a medical director for behavioral health at Molina, one of the Medicaid health plans here. And then also I'm a child and adolescent and adult psychiatrist, like I believe Dr. Berquist. So it's very nice to see you again. I was going to send you a message in the chat, but I didn't want to distract you while you were talking. So I just was thinking that if and when there are challenges about like where to help, where to get kids additional services in the clinical realm, whether both, I think going through, if the kid or teen is on Medicaid, going through their managed care plan like Molina and all of our colleagues / competitors, we each have like many staff positioned to help navigate care kind of outside of the system that you guys are operating, or outside the school system, and in partnership too. Oftentimes, kind of trying to figure out in and outside of school what works best for kids and families. And then also for like more specialized needs such as eating disorder treatment, early psychosis, etc. I'm not the expert on each of those, but we have like children's behavioral health care managers who spend basically like 90+% of their days helping kids in different regions around the state find services when they need them.
I thought of another thing. Specifically thinking about actually with Molina, what I found difficult is any kid who needs residential treatment. Somehow that is more difficult, specifically with your kids, than other experiences. Those kids always need to go through the CLIP process, which not all kids need that kind of residential. So that's something that's really, really difficult, I've noticed.
And that is I guess I have lots of thoughts on that, but I guess one very briefly, because I know that briefly, like, as I understand it, residential treatment for youth in Washington that's kind of preferred by Medicaid or funded by Medicaid is the CLIP program.
Poor Sasha. But yeah, it does sound like Celia, Davina, Vicky, Sasha's team, which I've also heard from the Community Health Plan of Washington, which is another Medicaid care organization. They do have some of these intensive sort of case or care managers in-house that can support navigation for students with complex needs. So as we start thinking about sort of the next leg of the journey, moving towards this more whole child service, I do think engaging with our MCO partners is going to be important. So we'll thank you all again for your continued participation and collaboration on this work. We'll follow up with everybody with the next Learning Network session, a follow-up survey, and continue to be in touch as the new funding rolls out and we make progress on getting housing and intensive case management services connected to the network. So y'all have a happy holiday season, and we'll see you soon. Thanks so much.